I first started having pain in my knees about 3 or 4 years ago. It was getting more and more difficult to sit for any period of time, 5 or 10 minutes. When I stood up, I'd have to stand there and stretch and wait a few minutes, and then after I stood for a long period of time, I noticed I was having pain and would have to sit down. So it was just a catch-22. It got to the point that I couldn't do my grocery shopping. I couldn't go shopping in Sam's. My husband had to start doing that. And I came to Hughston because where I used to work, we referred a lot of people here for work-related injuries and such. And I also had an uncle who had both his knees replaced here with great results. So I just felt like this, Hughston was the place I needed to come. The surgery was scheduled in March. I had it done on a Monday and was released on Thursday. Had it done at Jack Hughston Memorial Hospital. When I woke up from my knee surgeries, the staff was very, very helpful, very knowledgeable about the procedure, what had been done, and seemed to know what some of the things that I was going through. And they were there at a touch of a button if I needed anything for pain. The food was really good. The hospital was the cleanest I've ever been in. I began physical therapy on the Monday after my surgery, and that was at Hughston Clinic on Veterans Parkway. They were very encouraging. They didn't push me harder than they knew I could go, but they left it up to me. But their encouragement inspired me to do more. And I don't think it would be possible to have a knee replacement surgery and not have physical therapy. That is so vitally important to for you to get back to where you used to be. In December of 2010, I had my right knee gave way, and I landed on my right ankle and broke it. They scheduled emergency surgery, and it was outpatient. I was on crutches about 8 weeks. I also did my rehab for that at the Hughston Clinic on Veterans. After taking another x-ray in 2011, said that we did need to go ahead with the total knee. That was done on April the 11th, on Monday, and I was released on Wednesday. The first step that I took on Tuesday after the surgery, there was no pain, and in fact I started crying, and my husband asked me if I was okay because I was smiling and crying, and I told him that there was no pain. So it progressed, I think, much more rapidly. My recuperation period, because I had 2 good knees now and a good ankle to boot, that kind of got thrown in the mix. The things I can do now are back to what I was able to do before I started having knee pain. My quality of life is back. I can go in stores, I can browse, I can spend time, I can do my grocery shopping. My husband laughed the other day because I helped him unload the car, and he was usually doing all of that. I can go with him on motorcycle rides. I can get off and on the motorcycle. I never could do that before. Playing with the grandchildren and doing more things with them, especially because I feel like it now and I'm not in pain. At church, people have asked me, they've seen the pain that I've been in. They tell me I've gotten my smile back, that makes me look younger because I don't have that pain etched on my face anymore. They say, "Where did you get it done?" I have a sister that needs total knee replacement, but she won't go. She's afraid to go. She doesn't, and and I tell her, you need to go to Hughston. I have business cards. I've been referring friends. I have a friend who, they were in North Carolina. He works, he's a regional manager, had a car accident, broke his leg. And she called me and she said, where should we go? And I said, you need to go to Hughston. And they have been so pleased. Every time I see her, she said, we can't thank you enough.